A very good morning to everybody. Amropin expresses a very warm welcome to all of you. Amropin is an association of oral and maxillofacial radiology and oral physician in India. And I call them a special ops of the oral medicine and radiology department because they work behind the scene and are the most effective in whatever they do. Uh, what we are going to do today is to find out what are the different ways in which teaching technologies can be used. Today is Ganesh Chaturthi, so wishing you all, and also Jai Jinendra to all those Jains who are having pollution today. So what we are going to do is teaching and learning, and I am going to be today's resource person. Dr. Vasanti has already done 3 sessions with you, and again going to do 3 more sessions with you. So let us start with what is teaching and learning. Teaching basically is passive display of or giving instruction, and the students only listen passively, whereas the teacher is the one who is active. So it is teacher centric in nature, whereas learning is something which is done both by the teacher as well as the student, and that's why it is very active learning which takes place. Now, who is a teacher? A teacher is somebody who has is problem oriented. He's doing something of his own steam. He has got a personal interest in doing whatever he's doing, and that is why it is very important for him to be a change agent. Basically, he changes the way in which, so that the students are slowly taken from being a novice to an expert. So he's a facilitator. He creates an environment, an ecosystem where total learning is taking place in the college, and that is how the students learn. He uses certain techniques like group discussions, didactic lectures, and problem learning, as well as case studies, to see that teaching as well as learning both are accomplished as far as the student is concerned. Today we are going to do undergraduate teaching and learning process. What are the different methods in which it can be done? So what are the different teaching methods? Well, we have got sorry. A formal lecture which is there where students listen to the teacher. That is a lecture, that is the didactic lecture. If the staff member is moving around with the class, then it is an informal. If it is a question answer type, then it is called as a dialogue type, or dialogue questionnaire. A revision class is something which a formal teacher interaction generally done before the examination. Problem solving class is, suppose there is a problem and that is to be discussed along with the teacher, then that is problem solving. Self learning is being done where solving a problem is problem based learning. 4 or 5 students going ahead and giving a topic presentation is called as a symposia. A group of 4 or 5 students giving answering questions like we are going to have after this talk is a panel discussion. We have on a particular topic, if multiple presentations are going on, then it is called as a seminar. Seminar is something broader than a symposia. A seminar contains of suppose it is head and neck cancer, then everybody comes and presents. So there is chances of some presentation being repeated. In a symposia, it is just 4 or 5. They are divided the topic into their respective presentation, so there is no overlap. Tutorial is something which you do for remedial purpose. If some certain batch of student is not doing well, then we can go ahead and do a tutorial. Now, recitation is something which was done during our Vedic periods, and in our schools when we were taught mathematics. In medicine, in every lecture, we are trying to introduce new terminology. I think just before the lecture starts, if we ask the student to recite the new terminologies and their meaning, then it will remain in their mind for a lifetime. If an individual research project is done by a student, then it is an individual. It can also be done in a group. So, group research is there. Essay type of questions where the students are allowed to refer to the textbook is called an open book assignment. When you want to do patient education, you can use multimedia presentation. And the flipped classroom is you give a home assignment and then you have a classroom discussion following that. That would the flipped discussion classroom is something which we need to adopt today. The central part of any presentation is called the lesson. The lesson starts with a lesson planning. Then we introduce inside that the depth of understanding, the depth of level 1, depth 2, so which is your nice to know, good to know, that kind of. Then we decide which teaching aids to be utilized, and then we use certain aids like interactive whiteboard, online atlas, flash, animations which are done in multimedia presentation. This is different ways in which we can show and make the student learn from our presentation. So a lesson plan is something called as a concept web. It contains lot of things and all things are interlinked. So it depends on the objectives of the course. It depends on what the students want to learn. So it is also student centric. Skills which are the teacher as well as the students which has to be developed, materials which are to be used, what is the focus of the learner, what is going to be the approach of the teacher, that will be directed by the lesson plan, and what activities and evaluation ideas which can be utilized so that good presentations can be done. So what is the lesson plan? Lesson plan basically contains two things. One is the content and the other is the methodology. The methodology is any one of the methodologies which we can utilize, what we have already discussed. Content is something which we have to break down from a central unit to a subunit to elements to finer units. And basically, we have to see what interlinking is there. The finer elements also will be linked to the major unit or subunit, and how that interplay takes place. That ultimately constitutes what is the concept web. So a concept web will have a central unit, subunits and all, and they are formed in form of a template. For every lesson planning or every topic, the template will differ depending on what subunits is there, what elements are there. And that is why you have to decide this lesson planning for each and every topic which is considered. What is the way we deliver? It could be a question answer method, a narration method like your didactic lecture, a discussion method. You could combine them. It could be a demonstration if it is a psychomotor skill development. It could be experimental method if you are going to go for research purposes. If you are going for patient education, it could be exhibition method. And for certain concept to be made understood, role playing also could be utilized. So basically, what we do in education is take the students from the known to the unknown, from the concrete to the thing, simple to the complex, specific to the general, whole to the part, analysis to synthesis, empirical to rational. Out of these, the first three parts are generally at level 1, that is the what the student should know, recall memory. whereas the rest of the thing will go into depth of knowledge 2, 3, as well as depth of knowledge 4. So this is how you take the students from the simplest complex to the complex. So then we utilize many other things like for every lecture we should have a plan, a template should be there, and this template will have all this kind of matter which is there, so that whenever you want to go for to take a lecture, everything is ready for you, and that is why this thing administrative work should be done. Now, if you take an example of the temporomandibular joint, then you have the anatomy, the movement. So, temporomandibular joint becomes the major topic. The anatomy, movements, occlusion, the diseases, and everything, and the imaging becomes the subunit. This subunit can be broken down into elements like if I have shown it for imaging, so you can have 2D, 3D. That can be further designed. Then there has to be some certain amount of linkages also which is there. For example, just you take TMJ and anatomy, you have the joint, you have the muscles, you have simple, and then you have broken down into the product. Now suppose right side lateral oblique masseter muscle not working properly. What will happen? What will be the effect on the TM joint? What will be the effect on the masticatory muscle? What will be happen to the facial muscles? All this interlinking which is there, we have to do in the lesson planning itself, so that when you present it, students will come to know that there is interlinking. It is not just delivering, collecting data from your textbooks or from articles and collecting photographs and presenting it to the student. This interlinking is what makes them understand the concept, and that is why lesson planning is very important. So, in a nutshell, tell them what you are going to teach them, and tell them what you have taught. Now, that brings us to the depth of knowledge. The first depth of knowledge is the recall, reproduction. If any question directly gives you the answer, like for example, you have asked definition, what is a class 2 caries? Or what is the class 1 angles occlusion? Then in that case, the answer is directly. So this is basically a recall kind of a thing. And the student, that is the lowest amount of knowledge which the student should be able to have. In the psychomotor, suppose if you ask them, show me where is caries, then probing with the probe, that would be your depth of level 1. So this is how we do go for depth of 1. Depth of 2, that is DOK 2, that is not direct. So there is some amount of thinking going behind it. For example, you are asking the student to go for pain on percussion test. So when he does the percussion test, he has to evaluate that, right? By doing it on an opposite tooth, or doing it in the neighboring tooth first, and then going on to the tooth in question. So that needs a little more amount of reasoning, so skills and concept. And that is why, for example, suppose you have a lab report coming in. So what is the lab report signify? That would be your level 2, which you have to do. Level 3 is slightly more. There is more amount of thinking. Interpretive skill is required for that. So what is the, suppose if you have taken a case history, when you summarize everything, that would be level 3. So summary of everything. So you have the positive points, you have the negative points, and all these positive and negative points, when you assemble them into a form of summary, that is what is called as depth of knowledge too. And also the provisional diagnosis which you do, that also would come in level. Suppose if you are going to do a root canal, the opening of the root canal or something in the psychomotor skill would be something in level of 2, because there are multiple steps to be taken for the biochemical preparation, and that is why that will be as depth of knowledge 3. Depth of knowledge 4 is the higher. So if you are going to do research, or if you are creating a model, the prototype you are going to create, then in those cases, and then if there are multiple steps, for example, suppose you are doing diastema closure, then there are multiple steps involved in that. You are going to do implant planning. So there are multiple steps in all this will come in your depth of knowledge 4. So you have to take the students from depth of knowledge 1 to depth of knowledge 4, and that is how your teaching should be, and that is where it is based on the objective of your institution, objectives of your department, and special objectives of teaching which you have. So, what Dr. Vasanti spoke about the objective, that will be included in both your lesson planning and depth of learning. So, for example, suppose if I give you an example of how depth of learning can be done. So, suppose if I'm giving a lecture on the limitations of radiogram. Now, limitations of the radio would be because of the film characteristic, because it is a 2D image of the 3D image, it could be that. And then you break them down into different levels and teach the students in that particular manner, taking them from the less known to the complex this thing. First you need to do is go ahead and write the objectives which is there of the film characteristics which are responsible for causing an ideal image and how limitations can take place. In depth of knowledge 1, then you students will know that you have to write. What skills and what interpretations which the student need, that will go in depth of knowledge. Multiple steps which are needed to be taken, he should be able to demonstrate, or the student should be able to tell. So what resources which are required will come in that particular patient, and ultimately see to it that the student has learned that there are certain methods in which it will. Now, if you see the depth of knowledge 3, at the lower end of that, in the 2D to 3D concept, I have written a plastic cup. Now, I believe that for every lecture, you should have a prop to explain to the students during your presentation. Okay, for example, I take a plastic cup in the class and I crash it in front of the patient, in front of the student. So what happens is that I am showing to them that a 3D object is being flattened into a 2D image, and then give them a subliminal or conscious input. Say every time you go to the canteen and throw a plastic cup, remember that your IOPA, OPG, and the extra oral, these are all taken by conventional radiograph, are 2D images of 3D images. So it remains in their mind throughout. And that is how, for every lecture, if you have a prop like that and give a subliminal message, these things will, students will remember. Now, let us take the different methods in which you can utilize the different aids which are there. Blackboard and OHP nowadays not much is used, multimedia is used, but I'll just quickly go through the Blackboard. It's very easy. You have to write only points there. Don't write messages, then otherwise it becomes notes. So that is not the thing to be done. Colors to be used according to the background. It is a green background, only certain colors will only show up. In a black, everything will be done. While you are writing, do not talk, because then the students will not be able to understand. Dr. Vasanti talked about hidden curriculum, and we are the role models of that. So when we are giving a lecture and on the blackboard we are writing something which is so haphazard, then in that case, that is the student imbibe that and they feel that it is okay. So when they go to their clinics and when they arrange their instruments, sometimes it becomes haphazard because they do not understand the importance of being proper and being organized. Whenever we are to be very organized. the problem eye contact, because the face board while writing, what is happening in the class you will never know. Somebody might be posing, somebody might be talking, somebody might be texting, and that is the major problem as far as blackboards are concerned. The whiteboard is similar to the blackboard. Only thing is problem is that colors, and the whiteboard can be used as for presentations also. But you have to use better markers, because ghosting will take place otherwise, and it will spoil your whiteboard. So always see to it that you use good quality material. But today's generation probably to have some icons to click rather than using blackboards and even OHP. OHP also, the advantage is that the surface is limitless. In Blackboard, you have a limited surface. Here it is limitless. You can prepare everything in advance. Eye-to-eye contact can be maintained, and things can be preserved for future. In the Blackboard, once you wipe out, it is gone. Progressive disclosure is possible with your OHP. You can on your OHP sheet you can keep a blank sheet of paper that will block the light from coming, and then slowly you slide the paper down. So progressively, suppose if you are drawing a concept of a flow chart, then one by one that flow chart matter can be can be explored. So progressive disclosure. So there are certain rules for that. The visibility should be there. Letters should be 8 to 10 millimeter, 6 words in a line, 7 in a vertical line. All those things are there. Most important is any opaque material, even your pen can become a pointer as far as OHP is concerned. You can print something, photograph, text and everything on that and present it. That is also possible. You can draw directly when you are taking a class itself, you can do it. You can previously trace something from the textbook or from anything and can show that. So that is the advantage of OHP. So that brings us to the multimedia presentation. Multimedia presentation is very good in the sense that everything with the Blackboard and OHP is there can be possible on that. Colors are there, photographs can be added, videos can be added, animation can be done, sounds can be added. As you can see this particular slide, there are so many colors present. So that is a possibility. But room darkening and electricity is the main requirement. Now the selective disclosure which I told you, all this can also be done here. Slowly that whole entire concept can be developed on your slide. You can add video also. For example, here there is a video coming in. Something wrong. I'm sorry that I cannot show you the video. It is not coming on. But during the video being played, also you can write out all the material which is there. So you can explain the video as far as is concerned. The advantage is that attractive presentations can be done, variety of presentations can be done, backgrounds can be changed, emphasis can be done by highlighting certain areas. You can carry it by your CD, DVD or USB, or you can mail it, and wherever you go, you can do it. So it doesn't get lost in translation. Limitation is it is expensive, so you have to learn the methods of doing it. Darkening is required. Computer knowledge is required. But it gives you a lot of time to do something very constructive. For example, suppose you have got concept where you want to join them together and show them that these are interlinked. Sorry. Suppose you have a rectangle like this. You can change the shape of the rectangle by using the edit tool. Use the other and then let the matter come inside. So the matter will be seen on that, and you show linking. You see the hashtag logo behind. Similar to that, we can also do it on PowerPoint. It takes a little time, but also those can be linked. What I have shown is a very simple thing which can be done, but you can do a complex thing like the hashtag model also. Suppose there is too much matter, like something like this, and it is important for you to consider this important matter in that one particular slide also. Then that also can be done by giving different colors and making them, and that way we'll be able to show the participant the different thing. Hyperlink can be possible. You can go ahead with hyperlink and you can go back. 1 second, please.
We request the audience to please stay back till the time Modi sir is going to be back after drinking some water.
I'm sorry for the.
No, sir. Sir, just put the laptop so we can't see you, visualize you properly. Just put the laptop screen a little down so that we can see you. Yeah, that's fine. Thank you, sir.
Okay. So you can use this hyperlink. Now, on the next presentation, how it can be utilized. And we can go ahead with that. Animations are very important. Whenever you want to show some concept being developed on the and you want to make the people understand the concept, animation is a very good thing. For example, suppose if I want to show how the different shades of gray are present from when you are taking a radiograph, you can make a simple movement animation. A ray of is coming, it strikes the bone, then no shadow is there. If it goes through without turning, then it is a black shadow. Then if it is going through a solid matter, then it will, if it is a tumor or something, then it will show you a gray shadow. So different shades of gray. If this concept you are going to show to the student, then they will be able to remember it much better. Another thing is that you can build up a concept. Suppose you want to show the limitation and you want to see the cut section of a film, then you can do this and show them the different matter. For example, in in conservative, suppose you want to show a sub base, then a base being and then a filling which is being done, then in that case you can utilize this because these students will remember much better than just showing them a photograph of it. If you want to show how a 2D image or 3D image is being done, you can say that they are all in slices of the human body, which are getting compiled on one on top of the another, and that is how that image comes. And that is why the condyles, the anterior teeth, the parietal bone are all in one particular one plane. So it is a 2D image of a 3D object. Process dynamics are also very important. Even that can also be shown. For example, suppose if I am showing that how a latent image is being formed and how it is being developed, then I can show them that X-rays come and strike. One bromine ion will be liberated. That bromine ion will go into that sensitive spot which is going on. See, when I am talking, the animation is going on. So the interstitial silhouette will get collected exactly at the point where the sensitive
We are experiencing some technical errors. Please hold on till we check it.
And more photography will normally they get rejected, but the silver is present. You will get all those electron penetrating, and that is why now the silver which is bonded to the bromine, even they will get attracted to the sensitive spec. So as more and more electrons get penetrated inside, you will find that all the silver which is there will get attracted to that particular point. So as you can see, the entire animation takes place while you are explaining to the student how the process takes place. Now, since the silver gets liberated, the bromine is separated out and it goes into the solution. This process keeps on continuing, and that all the silver will keep on going into that particular area, and the bromine will get liberated and going to this. Ultimately, at that particular point where the sensitive spec is there, a large black silver will be created, which is your image. Now, X-ray film has lots of thousands and thousands of these silver bromide crystals. They will join together. If they join together and make a round shape, then it becomes a periapical. If it's a line, it is like your root canal. So from the root canal to the enamel, different shades of gray you can get, and that is how the radiological picture takes place. Now, this is a concept which we normally we just tell the student, which does not remain in their mind. But when you use animation, it remains in their mind, and learning is much better in such cases. Now, all this part was of teaching methods. Now, whatever I'm going to talk is about the learning methods. Interactive whiteboard is something which we need to incorporate in our teaching process. Components are that there is a computer, there is a smart board called as the interactive whiteboard, there is a projector, and there is a pen with which you can something. It is a smart board, so it has got its own different. So whatever annotations you want to write or you want to draw can be done on that whiteboard. Normally, in a PPT presentation, the arrows and all the pointing which you have to done has to be done beforehand. You cannot do it while you are taking the class. But if you are using a whiteboard, you can draw at that particular time also. All the diagrams or all circling or whatever highlighting which you need to do can be done at the time when you are giving the presentation. Why is it called interactive? Because students can be asked to come and complete something, draw something. So it becomes both staff as well as student, both doing it together. And that is why it is called as interactive. You can do any illustrations which is there. And the main advantage is, suppose if you wipe the board on the right hand side, your PowerPoint will go away on the right hand side, and you will get a blank sheet. So then you can keep on drawing, labeling, showing a concept out there, and when you swipe it back, your original presentation starts again. The biggest advantage is that whatever drawing and whatever explanation you have done will remain there in the same presentation on the whiteboard. So next time you use the same presentation, you will have your explanation also being there. It doesn't get lost. There are two types of whiteboards, thermal as well as magnetic. Magnetic comes with a pen. In thermal, you can draw it even with your finger. And if you have an epidiascope, you can project an image on the whiteboard and you can draw it with your finger or the pen, which is a great advantage of developing. Suppose you do not have very good drawing skills, even then you will be able to draw very well on a whiteboard. Now, there are two methods in which you can do it. You can have some smart devices and you can control the interactive whiteboard from there, or you can have a console like this, which is there. The console like this converts your entire lecture into a podcast. And that podcast, after the lecture is over, you can post it on the learning management software of your college, so that the entire people who are there, students, can go through your podcast anytime. Suppose if they want to go through that podcast just before the exam, they can do that. So that is the greater advantage when you are using an interactive whiteboard. Music can be utilized, and normally for any lecture should end with at least 5 MCQs given to the minute, because you want to know how much they have understood. It is not their attendance which is important, their presence is important, and that is why getting a feedback of how can you. So these devices which are there can be utilized. These are similar to what is being used in Kaun Banega Crorepati. So if you have given 4 options, people will write A, B, C, or D. They will punch there, and immediately you will get a graph saying that this many people have written A. Now, suppose everybody is almost the same, the A, C, D almost same. That means the concept students have not understood. So that means you have to reteach them in a different manner because they have not understood. If there is a steady graph where majority are saying this and then other people are doing, that means you have the concept is gone. But there are certain students who have not understood that properly. So you can have a special tutorial for them. To decide all this, an interactive whiteboard and having such kind of devices where instant reaction is there is very important. So go for a smart board. Flash animation is something like you must have seen how implants are being placed and all that. It is a total interactive manner. So here I am not going to show, I am just going to mention the name Flash. Now there is a major misconception about the lecture. People think that making a speech during a lecture is instruction. It may not be there. Your speech may be great, but students may not have learned anything. Covering information is teaching. That is also totally wrong. I call it bucket pouring. You take a bucket full of knowledge, pour it into the class, but whether the students have understood or not is a different matter. Being heard is communication. No question asked means they have understood. It may not be so. They may not have understood anything. Please group reaction means that they have learned something. That is also wrong, because you may probably have left them 10 minutes early and they are pleased because of that. Teacher activity is equivalent to student involvement. That is also wrong. In a didactic lecture, it is only teacher centric. And it is because everywhere didactic lectures are used, it is successful. Wrong. Research has proved that didactic lectures do not give. The main problem is when I teach them everything, everybody asks me, sir, how will I cover the topic if I have to use all these methods of new teaching method? The basic concept of a lecture is that you have to not to cover the topic, but to uncover the topic so that students discover the topic. That is the maxim which is required, and that is what we have to understand. You have to make the your lecture so interesting, the topic so interesting, that students should want to go ahead and learn on their own. That is the quality of a good teacher. Micro teaching is utilized for training new entrant in your department. So a 10-minute lecture is they have to plan along with your lesson planning and everything. So, and then they give that lecture in front of the seniors which are there to sharpen the skills, eliminate gross errors, and build up the confidence of the teacher. It does not deal with the matter because concept matter they are also MDS. So matter will be the same, but the way in which teaching is done, that is to be evaluated. So you plan, you teach, the observers that are the seniors, they'll give you inputs. If it needs to replan and reteach, that can be done till such time as it accepted. Then you can go ahead and give the lecture. So this is as far as micro teaching is concerned. That brings us to the most important part, that is your problem-based learning. In problem-based learning, students are divided into groups. Each group is given a particular task, a section of that topic. They will go and find out what they know and what they don't know. What they don't know, they will research. If certain skills are to be developed, they will develop. Then the students will regroup. They will interact with each other. And that concept web which I was talking to you about in the lesson planning, that the student will develop by interacting with the groups, and then they will come out with the entire presentation and present it in front of the class. This is how a problem-based learning will take place. Students identify what they know, what they don't know, and from where to search and get that information. The instructor doesn't teach anything. He just supports, he just guides, he monitors how the learning process is taking place. He's a facilitator, he is not a teacher at all. Now, let's take a case study. A patient has come with a swelling on the face, and this you show it to the. Now, the first thing where students will be asked is list the swellings which are possible in such a case. And then you give them the matter that he is a 18-year-old child, he is a Hindu, and he is a male. So, what does that signify? Does the swelling in young adults, does the swelling mean anything? So, the patient.
What is uncle telling more?
Now we give information about the patient having a swelling in the middle for 1 year. He had no pain. There was no symptoms of that nature. Now, is that thing important? The absence of pain, does it signify anything? 4 days back, the patient started having pain. So there is a change which has taken place in the disease process. Now, this is something which when we are trying to diagnose a case, this goes in the back of our mind. But we don't teach them. When we teach them, what we do, we classify the cyst of the jaw, and then we one by one we explain. No patient is going to come and say, "Oh, I've got a dentigerous cyst, please treat me." Patient is going to come with a swelling, and that is why our teaching should be molded there. This is possible when you are doing with problem-based learning. So now, as you can see here, the certain change has taken place. Previously, there was no pain. Now the pain has started coming in. So now you broadly classify the swellings which are there. It could be a cyst, benign tumor, malignant tumor, fibrosis, or it could be infected. Then the students are told to go and learn and find out what is the demographic of all the lesions which are there. So they go and find out what are the demographics, and when the session 2 comes, they come out with a list. Okay, this swelling could be all these kinds of diseases which could be present. Then you give them more information. Okay, history. Now, in this case, the history was not important, but in some other case, this history would be important. Then you give them the clinical examination. What are the different things? The most important part is that the swelling has gone right up to the mandible. It was in the maxilla, and now it has gone. That means some amount of infection may have taken place. Facial infection could be possible. That the students will learn when they do. The staff member doesn't tell them. Local rise in temperature is present. Heart consistency at the periphery. In the center, there is some amount of softness which is there. Palpation. Now, what does that signify? You know that it signifies that there is some amount of perforation of the bone is taking place. The cyst have come out into the soft tissue. which is why that has got infected. But this is developed by the student themselves. You don't do anything. Then you ask the students to go for frequency and the prevalence rates of the different diseases, and then you give them the radiological finding. When you give the radiological finding, you find that it is a smooth, round, circumscribed radiolucency. Lower border of the radiolucency shows cortigation, upper border does not show, which means it has got secondary infected. Now there are two supernumeraries in that. One supernumerary is probably in the bone because there is a follicle surrounding it. The second supernumerary is surrounded by the radiolucency, and the follicle cannot be seen. So it is involved in that radiolucency which is present. And then the students are asked, taking all this thinking into consideration, find out what are the different things and what are the disciplines. So ultimately they come out with this kind of a chart where it shows the dentigerous at the age of 11 to 20. The dentigerous cyst is most common. Radicular cyst is more common, but it is at a later stage. Other cysts also could be present. Now you ask the students to connect the dots. Painless swelling was there. Now it has, for the last 2 days, it has started paining. On examination, there is hardness and softness, both is there, which means that perforation has taken place. Supernumeraries are present, and there is a radiolucency which is surrounding the crown of the supernumerary, and the patient is of the age of 18. So when you connect all these dots, ultimately you come out with a dentigerous. So you are taking the students from what was unknown to then to a particular diagnosis, which can only be possible with problem-based learning. Because that is why it is more dynamic, and that is why in the Western countries now they are more and more doing it on problem-based learning. You can use a 3D printed model to explain them further how perforation takes place and things like that. That is also possible. Then comes your group dynamic, and in group dynamics, normally in a group you have to select a group leader and the rapporteur, but in a classroom it is always the teacher who becomes a group leader. And then activities are, people are encouraged to speak something and discussions takes place. So the work of a teacher is a facilitator. He creates, he solicits participation. He tries to draw them out. Instead of being quiet, let them talk. And that is the value in which, so he should be very skilled in the questioning method. All the contributions which are coming from the student, he uses a flip chart, and on the flip chart he writes that down. So he records everything. That is the work of the teacher. And one thing is that to find out who's the one who's going to speak, he needs to understand the body language of the student. If there is some student who wants to speak but is shy of speaking, he has to draw him out to see to it that he speaks up. So how structure is that you create an agenda, you create an environment, and you set down the objectives first, so on which the discussion is going to take place. So personal experiences and everything also would come into picture. And then the whole setting is done. Yeah, how to arrange the room arrangements in such a way that it is for students to interact. So it could be a classroom type or a chevron type where they face the teacher. It could be U-shaped where there is a lot of exchange going to take place of ideas, of paper, of written material. Then a U-shaped is much better because you are going to interact in that particular fashion. Half circle is generally used in workshops where the resource person will go around with each group and then explain to them. So that kind of arrangement is better. You always start the discussion with a non-threatening question. The question should be open-ended question. It should be a close-ended. And then you ask students to that. First thing is that after writing the question or telling the question, there is a pause. That pause is there for them, for the question to get synced inside minds of the student. Then to emphasize, you write the question on the blackboard or whatever it is, or the flip chart which you have, and that is why it will emphasize, and students' attention will be drawn to the question. And then you look for non-verbal indicators and you ask them questions. Always see to it that it is open-ended. Yes and no means will stop the discussion. You want discussion to take place, so the issues should be open. So paraphrasing should be done. So as soon as they start, it seems like you are saying this, or let me see if I understand you correctly. These are the sentences which you would use to make them give more and more information, and let the discussions keep on going. Encourage them, explore further. That also can be done by different methods we can do. Stacking is very important. Always see to it that every person who raises his hand should be given a chance to speak. Otherwise, that person will then never speak out and he will go into a shell. So, see to it that you catch people and say, okay, first he will speak, then he will speak, then he will speak or she will speak. And that way, you list everybody and let everybody's opinion take place so that they are involved into your sometimes balancing is required. Somebody makes a comment which is maybe controversial. So instead of the teacher giving value to that, he just bounces the question to the other people. He's saying this. What do you think should be? What is your position for that? So get people to talk about that and let them debate on those different controversial methods. Sometimes intentional silence is used for people to regroup, reinvent their thought, and that is what is important. Most important is listen to the common ground. When the discussion is taking place, what students have universally agreed, those points on the flip chart on the left hand side, you list down those points because that has been agreed by everybody. Then you list down on the right hand side those points which are not agreed by everybody, universally agreed. So in those steps, then you can start discussing on that. So either to totally eliminate if the points are not good enough, or by creating an agreement and ultimately going into the front. And the last thing what you would do is that once you have got all the agreed points from the discussion, you ask them to vote which is most important, which is next important, which is next important. And that way you find a hierarchy according to the importance of the different points. This assimilation will become the result of all the discussion we will take on that particular topic. So that is why discussion is very important. Which brings us to the flipped classroom. A flipped classroom is a blended learning where you give a home assignment and then there is a discussion. So content is at home and then the discussions takes place in the classroom. Why is it called flipped? Because there is reversal. Normally you would give a lecture and give an assignment. Here you are given an assignment first and then you are asking them to do it. Students should happen. Now, if you are using a flipped classroom, you are giving an assignment. You come to the class. So that way you are converting the implicit part into an explicit part. You can then add 5 MCQs in that and tell them that these MCQs you'll have to send to us because that will go into your grades. If you tell them that by force everybody will have to, so you are converting the implicit into explicit, and that is possible only with flipped classroom. What are the different methods in which you can do the flipped classroom? The standard inverted is the one where you give a home assignment and do this. It's a basic method. Discussion method is that you fix up an agenda and then you send a video only in regards to that agenda, and then you discuss according to the way discussion should be done. That is to be done. The demonstration type is for psychomotor skill development. So in the second panel discussion of Dr. Vasanthi, somebody asked about how carving can be done online. So here is the method in which you can do that. The demonstration method, the patient, the staff member gives a demonstration, step-by-step demonstration with the explanation, and that video is sent to the student. The student practices at home, and then he comes to the classroom. In the classroom, he brings his mobile, and the demonstration is right in front of them, and he goes, pauses it, goes to the next step, starts the video, pauses it, goes to the next step. That is how he gets a continuous kind of demonstration during his entire work. Normally, what happens in our method of doing it, they come after doing the entire thing. The last point, they come for taking signature, and then the staff member will say, "Are ye to ghode ka daant dikhta hai." So go and repeat. So it is demeaning also, and pay a student, because there is 1:15. There is one staff for 15 students. So continuous demonstration cannot be given. But with this flipped classroom, continuous demonstration is still there. Continuous attention is still there. The Fox flipped classroom is where the video is given during the class, and the staff member moves around and sees to it that the explanation is given. The group classroom is similar to problem-based learning. You create groups, give them the video according to the group, and then they come, the group discuss, the interplay between the groups takes place, and then the whole concept can get developed. That is how a group will be. The virtual flipped classroom is what is happening in schools nowadays, that students are learning at home. If one-way delivery is done, there is no interaction. Even this webinar is something like that, virtual flipped classroom. And the flipping the teacher is one like your online distance learning. You give matter, send the matter over. The teacher is not involved in that. Only the subject matter is given. The student learn, and then a fixed date is there for the exams to be given, and he gives the exam, and he gets the diploma or degree, whatever. So for the flipped classroom, the Bloom's taxonomy pyramid is inverted. The remembering and understanding part in the residence or the video which has been sent. During the class, the applying and analyzing takes place. That is, during the classroom, that discussion takes place. And if further developing of the concept in the form of a research or anything has to be done, then it happens after the classroom. So the Bloom's taxonomy gets inverted, but nevertheless remains the same. The flipped classroom has a flexible environment, so time is left to the student to do that. It is a total learning as when the students themselves do it, and you can take them in a scaffolded manner from the lowest to the highest depth of learning. And there is a concept development also which is taking place. For that, the teacher should be very good. He should be able to give constructive criticism, tolerate the chaos which takes place during discussion, and manage that particular chaos which is going. And that is how flipped classroom is the best thing that has happened to us. The practical training in the pre-training, the most senior most staff should always go. Self-evaluation we never do. We finish the product and then we ask for a signature, and students don't learn anything. And many a time they are asked to repeat. So that is because we have never taught them how to evaluate themselves. So self-evaluation should be there. And you have to take into consideration it is a psychomotor skill development. Don't include theory into that. It is just that psychomotor, how good a cavity cutting is. The concept of whether the physical matters of that should not come into that. Theoretical matters should not come. Ergonomics, foreign dentistry, and tooth isolation is something which we never did, and the preclinical class is the best time when you can do that. Always start with an air rotor. Micrometer should be used only for finishing, because they are ultimately going to use only air rotor. Then why you should teach them in micrometer? All procedures should be taught to them. We use 2 years of preclinical just teaching amalgam filling, and in the clinics they are doing composite. If you are not teaching them composite, you are not really doing any preclinical. Competency based, 360 based, and transition from preclinical to clinic, we never do it. That transition, the last 1 month of their preclinical should be that they should go and assist the third year and final year students in the clinic, so that they get a chance to know what is the difference between the preclinical and the clinical settings. In the clinical settings, then what we are doing, we have to differentiate into different types of competency. Medical skill development, professional development, ethical, creating informed patient, competency oriented, foreign dentistry, EBD decision making, 3D decision infection control and fluid. All this can be done in the clinical teaching. So in the end, for the Jains, Gachami Dukram, for everybody else, Ala Re Ala, Ganpati Bappa Ala. Thank you very much for patient listening. It was great to be talking to you. Thank you.